I'm just saving it and getting the scan code.
પરાગભાઈ ને કહી દો ને કરી
Sir, you
દેશે
can
ત્યાં.
share. Yeah, Parag sir can share along with the slide.
So I think Parag bhai shuru karta
Should I
pehla he
share?
can share that things.
Okay, should I share this slide?
No, not now. After we finish the introduction.
એમાં ટેસ્ટ કર ડેમો કરી લેવા દો.
Just
પણ તો YouTube live ચાલુ થઈ ગયું.
પરાગભાઈ ને કહી દો ને કરી
Sir, you can share. Yeah.
Okay, Viraj, go ahead.
We can also attempt.
Viraj, let us start. 3:30.
હા. Parag bhai screen share બંધ કરશો? Good afternoon, everyone. Good and warm welcome, all of you, all the guests, all the faculties, and all the audience for today's Neonatal PATHSHALA, which is related to breastfeeding. And 1st August to 7th August is the breastfeeding week, and that's why we have rescheduled the things in the PATHSHALA. And today we are going to have an expert talk about the breastfeeding. And without much delay, I request my President, Sir, Dr. Yogesh Parikh, Sir, to start the session and welcome the audience. Over to you, sir.
Thank you, dear Dr. Viraj. Respected today's chief guest, our past president of the Central IIP, and my mentor, Dr. Uday Bodhankar, sir. My dear friend, Dr. Keshwalu, sir, Keshwaluji, guest of honor. Our esteemed faculty of today's session, Dr. Parag Dagli. All the NNF Gujarat team and the dear friends and all the colleagues who have joined on this digital platform. It is warm welcome to all of you and immense pleasure to welcome on this inaugural session of the breastfeeding week. Today the Neonatal PATHSHALA, our flagship CME series of the NNF Gujarat, and we all know this is a very much important initiative by the NNF Gujarat for our collective vision to create the structured academic platform to give the advanced neonatal care and foster the dialogue and empower the pediatrician and neonatologists with the evidence-based practice. So we all know that today's theme is very important, establishing the and sustaining the breastfeeding in the modern era, challenges and the solutions. It's very important, timely on this World Breastfeeding Week celebration. We all know the breastfeeding is not merely the biological act, it is the cornerstone of all the neonatal survival, neonatal care, neonatal growth, and the long-term health impact. So in the modern era, we face many challenges. Sometimes in like the urban lifestyle, workplace constraints, cultural beliefs, and the influence of the markets also. So much commercial substitutes of the milk is available. So all these are challenges, and we have to address these all not only in the clinical practice, but also for our duty to advocacy and the innovation and sustain community engagement for the neonatal care and the breastfeeding establishment. So I'm very much confident that under guidance of our expert faculty, Dr. Parag Dagli sir, and his wisdom shared by all the distinguished guests, Dr. Bodhankar sir and Dr. Keshwalu, and today's session will illuminate the practical solution and inspire us to strengthen the breastfeeding practices across the diverse setting. So let me take a opportunity to acknowledge our dedicated team of the NNF Gujarat, Dr. Viraj Thakkar, our dynamic secretary, Dr. Svetal Bhatt, the project in charge, and Dr. Urvi Sangvi, our meticulous coordinator, whose commitment has transformed this vision into reality. And our backbone of the Neonatal PATHSHALA, Dr. Ronak Patel, he is always with us in all the difficult situations. So as we embark on this academic journey, let us reaffirm our pleas to nurture every newborn with the best possible care and to empower family with the knowledge and uphold the breastfeeding as a universal right. It is not only the biological, it is a universal right of each and every newborn. And it is our responsibility as a NNF Gujarat and as a pediatrician neonatologist. So with these words, let us start the Neonatal PATHSHALA today, and let us have a great learning and collaboration and innovation for this Over to you, Dr. Biraj. Thank you.
Thank you, sir. Thank you, sir. And now I would like to introduce Dr. Urvi Sanghvi, who is our coordinator for today's PATHSHALA. Dr. Urvi is the neonatologist at Anmol Newborn Center at Rajkot. And Urvi shall be taking this program further with the introduction of chief guest and guest of honor and everything. Over to you, Urvi.
Thank you, Biraj. Thank you, Parik sir, for the kind words. I welcome all the guests, our expert speaker, our project in charge, and good afternoon all. Not taking much time, I invite our chief guest, Dr. Uday Bodhankar. Sir is Executive Director of ComHead UK. He is Director at the Bodhankar Children Hospital, Nagpur, India. He is affiliated as Honorary Professor of Pediatrics, National President of IAP in 1994. He is International President ISTP in 98. He is also International Council member of ASPR Japan. Sir is also Adjunct Associate Professor at the Sydney University. He has many publications and he has received a Lifetime Achievement Award of IAP, ComHead, NNF, also Fellow of IAP, NNF and FRCPH UK. I welcome Uday sir and I request you to say a few words.
Thank you. Thank you, Dr. Urvi Sanghvi, for that kind introduction. But let me welcome you all, Doctor. Particularly, I am really honored to I've been observing the Neonatal PATHSHALA, which is conducted as a flagship program of NNF Gujarat. Urvi and Dr. Yogesh and all, my journey goes back more than 2 to 3 decades when I was having blessings of Dr. Aulukita Desai Madam and Dr. Shashivani. I used to work with IIP and both at the national level. So I'm really grateful to you, Dr. Yogesh, for inviting me. My personal gratitude to Dr. Yogesh, present patient, to Dr. Monish Shah, who is a patient elect, Dr. Nirmala Chaudia, past patient, Dr. Biraj Thakkar, Secretary, NNF Gujarat, and of course, our guest of honor, my friend from my own city of domicile, Hyderabad, Dr. Kesavelu sir, Dr. Shwetal Bhatt, in charge, Dr. Urvi Sanghvi, coordinator, and of course, the expert who is going to give us preamble, Dr. Prahlad Dagli, and all the members who are OB and AP of NNF Gujarat. I'm really overwhelmed to present here. As you all know, breastfeeding is a very near to me. But for your confirmation, Urvi and Yogesh, 6 month maternity leave was sanctioned by IAP in 1994 election, Pedicon in Nagpur. And then after that, we followed up and it took more than 10 to 12 years to get it sanctioned by state government and central. I think the credit goes to IAP and NNF together, and government of India. You all know breastfeeding is not merely a method of feeding, as you are going to be learned from Dr. Dudley. It is the foundation of lifelong health, neurodevelopment, immunity, and emotional bonding. Every drop of breast milk is a nature first vaccine. You all know very well. Further going, despite overwhelming evidence for the advantage of breastfeeding, modern lifestyle, increasing cesarean section, maternal employment, misinformation on social media, and aggressive marketing of breast milk substitute continue to challenge breastfeeding practices in India and abroad. Healthcare professionals play a vital role, like we all IAP, NNF together, and Foxy also, as our patient has formed Breastfeed Alliance along with IAP, NNF, Foxy, and Nursing Association. Good step by patient. Consistent counseling during antenatal visit, at birth, and during postnatal period significantly improve breastfeeding success. Further, if you want to say in nutshell, uh, breastfeeding is not only a child survival strategy, but also an investment in healthier families, stronger communities, and a healthier nation. To conclude, uh, let us remember that every mother deserves support, every newborn deserves breast milk, and every healthcare provider has the responsibility to protect, to promote, and support breastfeeding. Together, I think we can transform breastfeeding from a personal choice into a social commitment. My best wishes to NNF Gujarat for organizing this important neonatal PATHSHALA program, and to Dr. Parag Dudley, whom we are going to listen for addressing such an important subject. Thank you.
Thank you, sir. Really a landmark change. Who can understand better than a mother? 6 months leave. So that's a great thing. Thank you, sir. Thank you for the kind words. Now I invite our guest of honor, Dr. K. Kesavulu, sir. He is a central IAP EB member in 2024, organizing secretary of AP Pedicon 1999. He is President IAP Sri Satya Sai District Branch IAP, President NNF Sri Satya Sai District Branch AP, member of National Advisory Committee BPNI, and also BPNI's training coordinator. Sir is a retired civil surgeon, pediatrician, former medical superintendent, District Hospital, Hindupur, Andhra Pradesh. His main area of interest is infant and young child feeding, community newborn care, BFHI promotion, IMS Act monitoring. He has got the Best Doctor Award by Government AP in 2013. He is also recipient of State Honor Government of AP 2010 and 2018, IAP Social Champion Award in 2023. He has also worked in association with Breastfeeding Promotion Network of India and also received the Dr. P.S. Reddy Oration LAMCON 2022 in Hyderabad. He is actively involved in IVCF counseling capacity building courses for state governments. Welcome, sir. So I request to say a few words.
Yeah. So very good afternoon to all the distinguished members in the digital platform. I my pranams to our past president of IAP, Dr. Uday Mudankar sir, and our past immediate Honorary Secretary General, Dr. Yogesh Parikh sir, and today's distinguished faculty, Dr. Parikh Begli sir, and then in absentia, Madam Shashivani, and the beloved office bearers of NNF Gujarat, and in today's Neonatal PATHSHALA team. And my special thanks to Urvi because he has been reminding me many times to be present today to this platform. In fact, I am at Chittoor at the CMC campus of Vellore. There is a unit. So today I have been asked to participate as a guest speaker in the Chittoor Christian Medical College Vellore campus. After finishing the meeting, I am here. And really, it is a great opportunity for me to be guest of honor. Really, I am highly privileged. The moment Dr. Yogesh Parikh sir called me and told, "You are going to be guest of honor, sir," I really wonder whether I deserve the status to be here. I feel it is a great God's blessing for me to be here on this Augustus Breastfeeding Week celebrations. We have been celebrating since 1992. In the 1992, we celebrated with the theme of Baby Friendly Hospital Initiative. Today, it is going to be 35th World Breastfeeding Week. With the theme of breastfeeding, sustainable start in life, and what works. We all know that breastfeeding is not only a source of nutrition, it is a source of protection and affection, and it nourishes and nurtures the babies. We all know that breastfeeding is a cornerstone for the child's survival, health, nutrition, and development, whatnot. And nature has provided potential for each and every mother to nourish the baby's bond to her. Even if it is triplets, not an issue. They can be successfully exclusive breastfed after 3 months. But in spite of all the facilities, and 90% of deliveries happen in the institution, sadly only 50% of babies are able to get the benefit of early initiation of breastfeeding. And it is not to blame anybody, because the reasons are multifactorial. Many of our colleagues and the people working around the mother, they are not trained. So one should receive structured training. Then only they will be in a position to help and support the mothers. See, the eyes can see what the mind knows. When the mind is blank, how can they help and support? There is a need of training of every healthcare provider. See, my sincere question is, who is prescribing the formula? We are only prescribing the formula. So why to blame anyone? So unless you are thorough in breastfeeding management, it is very difficult to help mothers The things has changed, and there is a very big force from the manufacturers of the milk powders. So they will be aggressively marketing. We cannot find, because they have to survive. No, it doesn't mean that we have to prescribe. Who is prescribing? We pediatricians, untrained people, unconvinced people that breastfeeding alone is enough for them. So that is the sad state of affairs. So we are going to get all our doubts cleared with the distinguished faculty's deliberation by that is Parag Dagli sir. Once again, I salute Dr. Yogesh Parikh sir and the NNF Gujarat team for giving the great opportunity to be as a guest of honor, along with the distinguished personality, an international person like Uday Bodankar sir. I touch your feet and I say salute. So thank you very much. Thank you very much. Thank you very much.
One minute. Thank you, Dr. Kesavalu. I would like to conclude with Namaste, Shubha Bapor, Kemcho, and Abar. Thank you.
Thank you, sir. Thank you.
Thank you, Purvi.
Yeah. Thank you, Kesavalu sir. Thank
Thank
you,
you.
Uday sir. Now I request Shwetal madam. She is the HOD of Pediatrics at Baroda Medical College, past president NNF 2024, and in charge neonatal ICU in Baroda Medical College. Welcome, madam. I request you to take over.
Madam, please unmute.
Shwetal madam. Unmute, madam. Unmute.
Yes, done. Thank you so much, Dr. Urvi. Really, it was very heartwarming to listen to the opening comment of Dr. Uday sir and Dr. Kesavalu sir for the breastfeeding. And as Dr. Kesavalu sir, it is we are responsible. Who are prescribing? We are prescribing. And I met Kesavalu sir in Delhi for a quality improvement initiative. And like, he is a passionate person. And Uday sir is also very passionate about sustaining the breastfeeding, which is our theme this year. The thing which is proven that we need to strengthen, that is the theme this time. And when Virat say, "Ki, madam, you have to coordinate this time," so you have to decide whether panel discussion or an expert talk. And only one name came into my mind: a Gujarat stalwart, a passionate breastfeeding promoter, Dr. Parag Dagli sir. Dr. Parag Dagli, he is a director of Apple Institute of Child Health, I'll say, because he is an intensivist for neonatology as well as pediatric, and still a very, very passionate promoter of breastfeeding. I've listened him, I think, for 100 times. More than that, must have listened him. And the way he simply explains is commendable. All the complicated things he keep aside and explains that we are mammal and all mammals are feeding the babies. Why human is having challenges. Why we need to keep a topic of challenge and solutions. So hats off to Parag Bhai for making it simple. Hey, hum mammals, so mammalian are going to give breastfeeding. So it will be wonderful to listen to Parag Bhai. Parag Bhai has many feathers in his cap. He is a founder member of KMC Foundation. And I know Parag Bhai from undergraduate days. He's a passionate teacher also. We as a juniors used to study his notes. So welcome, Dr. Parag Bhai. And thank you so much for accepting our invitation. Over to you, Parag Bhai.
I'm really obliged. I'm really thankful to all the stalwarts who present over here, right from Dr. Uday Bodankar and our friend Dr. Keshavalu, Dr. Yogesh Bhai, the entire team of NNF for inviting me over here on this platform for the subject which is actually very, very close to my heart. I'd like to share.
Parag bhai, thoda loudly.
Okay, sorry.
Because the recording people will not understand.
So am I visible and audible now?
Yes, sir.
Yes. So before I start, I'll ask whomsoever is present over here just to keep this photograph of this scan, and at your convenience, you just fill up this small form of 10 questions. It's a pre-test kind of thing. Of course, we are not going to give any marks, and we'll now move to the today's topic. We have limited time, and so I'll sorry, yeah. As Shwetal rightly pointed out, that we are what I advocate as well, that we are mammals. We are number one mammal, if at all we believe so. And out of some 7,000 species which are present in the world currently.
सॉरी पराग भाई, आप प्रेजेंटेशन मोड में डाल दो उसको, प्रेजेंटेशन मोड में नहीं।
Okay, this is I think showing.
हाँ प्ले कर दो ना। नहीं, आपका दो, आपका मोड में ना वो दोनों दिख रहे हैं, आपका अगला स्लाइड भी और पहले वाला ये भी।
सर दिखेगा तो भी बहुत प्रॉब्लम नहीं है, आई थिंक दैट
नहीं
इज
वो तो
आल्सो
वो पूरा स्क्रीन में
The
आ जाएगा तो
slideshow
अच्छा
mode,
है।
sir.
स्लाइड
okay.
शो
Click
मोड
on
में डालो।
slideshow mode. I think the fourth icon.
Let me check. Okay, share settings. Share. Okay, is this fine now?
Yeah, okay, sir.
Okay. So, out of this 7,000 species which are currently mammalian, mammals appeared on this earth around 60 million years back. We humans are present for last 3 lakh years, and over last 300 years we have evolved to be modern or educated, and last 300 years we have evolved to such an extent that something which was sustaining for last 60 million years, we are currently facing trouble to that extent that 50% of our own newborn babies are not able to receive exclusive breastfeeding, nor they can sustain it for, I mean, they're not, they can start right or birth within first hour of life. So, and that is mainly because of the education probably we have received or the evolution we have done. Well, let me ask you a simple question. What is the best food for a 2.5-year-old infant? In our second standard of education in the schooling, we learned that the best food would be milk. And which milk? The one which is white filled in the glass, that is dairy milk. Why not human milk? Well, human milk is the best food for a 6-month, 12-month, 24, 36, or even 60-month-old infant. Am I right? Many people may not agree, because for a long period we have been learning that exclusive breastfeeding till 6 months, and after 6 months, timely introduction of complementary feeding. This is what used to be the WHO's recommendation. But now they have added a third line that says that breastfeeding to be continued till at least 2 years and more, as long as baby wants or mutually both the mother and baby want. Could it be 5 years? Why? Well, there is a group on Facebook called Breastfeeding Support for Indian Mothers, which has got some 1.5 lakh mothers, where mothers regularly post that now my baby has completed 3 years journey of breastfeeding, now is 4 years. The admin of that group, the Adunika Prakash, has given her 2 babies for a total of 13.5 years of breastfeeding. I know many of the pediatricians themselves may not agree, but importance of breastfeeding beyond 2 years, if we consider, we know that up to 2 years it will provide a good amount of nutrition along with many other things. But even after 2 years, it will provide nutrition of less than around 10%, 10 to 20%. It contributes to brain growth, which grows on till 5 years of age, and you can have higher IQ if you are continuing breastfeeding. Immunity matures of infant by 5 years, and the child who receive breastfeeding will have lesser visits to a pediatrician. Actually, they will reduce our own business, but that's not important. And these babies are contrary to the popular belief. They are more confident in later life if they are allowed to wean on their own rather than fixed time weaning by 12 to 24 months. They have better bonding and they are better secure in their life. And why I'm talking about a 3-year-old baby receiving breastfeeding is one of the term which recently have come across, which is called backwash breastfeeding. What is backwash breastfeeding? When a baby is suckling at breast, the intraoral pressure. See, we all are pediatricians right now, and I'm talking about certain things which are very, very important for us to know, and they are actually recent advances. So if we know them, then I'm sure we will be able to, help mothers more by counseling and other measures. So while in this suckling, the intraoral pressure will become negative and positive, relatively positive. While with this positive part, the saliva will go back into the breast, milk ducts. Will along with that, the saliva and the bacteria of oral cavity. If the child is sick, suppose if he is having influenza virus, that virus will go into the mother's breast ducts, where there is a memory associated lymphoid tissue, MALT. This tissue will, or the immune cells will get stimulation over here by the exposure to that virus, and they will start producing immune factors. And the next time onwards, the baby will get breast milk, which is rich in immune factors that will help the child to recover from that infection. So it will act just like a pediatrician who will examine the patient, and if required, he will give antibiotics. Something like a pediatrician also does, he gives vaccine. So this breast milk works as vaccine as well as medicine, and these are according to mother's lifetime collection of immunity. Whatever she has acquired over 20 to 25 years, she will transfer it to the baby. These cells, these immune factors will go inside the baby's system. There they will get established, and they will stay there for a pretty long period. They said that up to 14 years or more. And now they said it will stay for almost lifetime. So maternal immune cells will stay in baby's immune system, and after say around another 20-25 years, the baby becomes pregnant, she may transfer those immune cells or her own to the next generation. This is non-genetic transfer of immunity to generations. This is what nature had designed over 60 million years. And then we think that no, we know much better, and after 12 to 24 months, what is the need of breast milk? There is no need. I mean, this is nothing but it is our misunderstanding or our underrating of whatever nature has arranged. So, breast milk is simply not just nutrition, it is not lactose, protein, or fat, it is much beyond that. All the minerals and vitamins that a baby needs, hormones and growth factors, they are there inside it. There are microbial communities, there are microRNAs, and believe me, these are not there just by chance. It's not that they are spillover from the human blood while the process of lactogenesis happen. Every molecule of this is probably arranged inside that component, inside that breast milk. So this huge orchestra is a complex and diverse spectrum. It is not just nutrition, it is nutrition as well as many other things. Immunoglobulins, microbes, cytokines, melatonin, hormone. I mean, name it, and whatever the baby can need, it's there. It's for the complete growth, physical, neurobiological, cognitive, metabolic, and immune development of infants. So if at all there is Amrit on earth, it is mom's milk. And this was proven in 2005 Neonatal Survival Series. It has been presented in Lancet. Look at this data. Breastfeeding and kangaroo mother cat, two most basic requirement of baby, two most basic our virtue of being mammalians. Keeping the baby skin to skin and giving breastfeeding. That can reduce mortality by nearly 50 to 70%. I'm not saying that ventilator or surfactant or resuscitation are less important or not important. They are, but look at the number of data. This says that we are simply neglecting these two parts. I know that if today would be a presentation of say CPAP or something, the attendance would have been much larger. But I'm not worried about it. I'm really happy that whomsoever is interested is present over here. So I'm going to present about certain recent advances in breastfeeding. We all feel that what is new in breastfeeding? Then I'll just like to bring to your notice that yes, there is a huge science behind it going on, and then there are certain common sense things as well. So out of this first two, 5 year full of breastfeeding and backwash milk, I've already described. Rest I'm going to describe one by one. We believed that human breast milk is sterile, right? No. We thought that if there is any bacteria found in breast milk, then it is probably contaminant, or it is passed from maternal illness, or it is because of incorrect handling, or it is expressed. No, breast milk has its own unique microbiome. These are specific organisms which will inoculate the infant gut with commensal bacteria after birth, what we call as probiotics. And not only by this bacteria probiotics, the breast milk also provides a system that promotes its proliferation. So it gets it to establish, and that's what is the prebiotic. We'll discuss about both these things. So human milk has got a number of bacteria. You can see here the list. actinobacteria, then bacilloids and bacteroids. I'll not go into big detail, but they are there to colonize probably gut and maybe many other organs of the human system, including meninges or including any other organ. Now they said that human body has microbiome in all organs, and this is the first step whereby the sterile babies, each system will get organisms, and these organisms are derived from the sites which are identical in mother. So mother's gut bacteria will transfer to still they really don't know how this happens, but then those bacteria, those colonizes that will go through the maternal milk to the baby's intestine, and probably in similar way to all other systems. They are there to mature the immune system. They are there to prevent the infections. And now you realize that there are 10 raised to 4 to 10 raised to 6 the colonies of bacteria per each 100 ml of human breast milk. As I said, its source is probably enteromammary pathway. It could be any other organ inside the mother's body. This could be human breast tissue microbiota as well. Mother's skin can also contribute to it. And these are there since beginning. I think Dr. Saurav Datta has presented around 5 years back a oration on this, that human milk is not sterile. It is colonized, or is colonized with helpful of friendly bacteria. Similarly, HMO, many of you might have heard this name through our formula promoters, that now our formula has got 2 to 5 HMO, and because of that, the price of formula is rise now to 1.5 to 2 times. Human milk has more than 150 identified human milk oligosaccharides. The amount is 1.2 to 1.4 milligram per 100 ml, which is more than protein content of mature milk. Now that is really surprising. If the milk is only nutrient, how can this molecule, which is not digestible by infant intestine, so these are not digested and they go undigested till the colon, where they will help those human milk microbiome to get established. This is their food. So this is not a baby's food. Not only that, these HMOs have got multiple works. Look at their role. They work as prebiotic. They are anti-adhesive, antimicrobials. They will reduce intestinal cell epithelial cell. They modulate the intestinal epithelial cells. They are immunomodulators. They are modulators of leukocyte rolling and adhesion. Not only intestinal immunity, they have probably role in brain development as well. So human milk oligosaccharides is probably the next generation thing, next in thing. Growth factors. We earlier used to know that there are now growth factors in the breast milk, but now we know that there are not only now growth factors, there are vascular endothelial growth factors, hepatocyte growth factors, epidermal growth factors, insulin-like growth factors. They all have got their some other role in development and maturation of infant systems. Each and every system is supported by these things. And as I said, they are not there by just chance, they are actually arranged. Often our baby who is in NICU, who is sick, very sick, who probably has some abdominal distension, suspected NEC, we don't give anything by intestinal route. Or sometimes when the baby is on ventilator, they are given RT feeding. So their oral cavity receives nothing. Now oral cavity is covered with a wet mucosa, which is a potential source for infection. Oral immunotherapy has been tried for last almost now 10 years. And what they do is they cover or coat the oral mucosa with mother's own colostrum or breast milk. And this is when the baby is either even NPO or on ventilator. This will not get aspirated because the amount that is introduced into the baby's mouth is hardly 0.2 to 0.5 ml. This 0.2 to 0.5 L has got many immunological components we already know. I mean, I can take one full lecture for just immune factors of breast milk, but right now, with the constraint of time, it has got simply Ig and several other immune factors. This will reduce clinical sepsis. This will inhibit pro-inflammatory cytokines, so it will actually control the sepsis process. It will increase the level of circulating immune protective factors in extremely premature infants. So this is oral immunotherapy. Those who have not started yet in NSU, I would request them to start at earliest. Now, there is one more term, intranasal administration of human milk. Now, human milk has got, as I said, it is called amrut, right? Now, we know that brain once get damaged, permanent damage, nothing can help. But now we realize that human milk has got stem cells, immune factors, growth factors, everything that can protect or reverse brain damage, potentially, for example, with severe IVH. So it's been proved with safety and feasibility that intranasal own mother's milk therapy can be given up to 28 days in they're tried in 37 preterm babies. This reduces the brain injury and probably helps in IVH related later on periventricular mucomalacia. Even we have tried in several other conditions like HI or by early onset meningitis, and it is not at least harmful. What is the best warmer if somebody can think about, right? Giraffe, a ranging or a incubator which is costing somewhere around 10 to 20 lakh rupees. Are they really, is these machines are really, really extremely good? Can there be anything better than that? Well, yes, nature had designed one another tool, another instrument which we can never compare, and that's the mother. Traditional warmer and incubator will cause inevitable separation of mother and baby. With the perception of better outcomes, I think all of us try to do it. But now we have been understanding, as Dr. Niels Bergman had said, mother is a superior incubator. Mother's body is the biologically normal place of care, both for normal healthy babies as well as for smallest preterm babies. You know, we generally try to avoid disturbance to all those tiny premature babies that by disturbing them, their vitals will get disrupted and they may get some other troubles later on in life, including IVS, other things. But everything has been wrong. It's now proven that baby needs maternal sensory inputs that regulate its physiology, that reduces its harmful effects of separation. So, a baby mother is required for baby and vice versa. Baby is required for mother to be a mother. So, there are neural processes that will start only after the baby's touch and that will help mother to behave more like a mother, that will improve the lactation as well. And that's what we now try to say is zero separation and IKMC. We wish that any baby who is delivered, I mean, either it is normal full-term baby, healthy baby, or even a sick baby, all babies should receive the mother's touch as early as possible. The zero separation aims at everything to be done on baby's mother's womb. Well, that may not be practical unless you are really trained for it. But then if we try today, maybe after some time we will be able to do that. And that's what has been proven now by an intercontinental 2021 study by 5 different centers that IKMC, Kangaroo Mother Care, started within 2 hours of life. Even before the baby is stabilized, the outcomes are better, contrary to what we were scared. The results are better, the patient stabilize faster, and mortality is lesser. With the same thing, I would invite all of you to join a workshop on IKMC, which is right on the next week, 14th August, Friday. Next part I would like to discuss would be pain management. You know, we are very much casual about a newborn baby's pain perception. We believe that, okay, it's okay if baby gets a prick, it will cry for some time, that's what. But then it creates a stress and it has got a neurodevelopmental poor outcome as well. So they said that comfort measures should be tried for each and every painful procedure, including even a sugar. I mean, when we are checking sugar with the prick, or any sampling or IV line insertion, anything. So kangaroo mother care and breastfeeding again are two wonderful things which can be offered without any cost, and they are readily available and they have proven to be beneficial. Of course, there are other measures as well, but these two are easily feasible. Uh, First, breastfeeding after normal delivery. Although we had talked about several things which were very hi-fi things, this is now a basic part. In 2006, I had seen this video, although today also we regularly see the babies offered breast after 24 or 48 hours. But then when should we start? This is a breast scroll video. Sorry. Oh, sorry. I'm sorry, just a moment. Yes. So breast scroll video was first time produced in 2006, where a baby immediately after birth, if it's offered to breastfeed, it will do on its own. Mother is lying flat, doing nothing, and the baby within 10 to 45 minutes will receive its first feed. Similar thing is possible with CS delivery as well. If given a chance after the birth, baby, if offered breastfeeding, it can start taking breast milk right in the operation theater. And believe me, this has been done in one of my close relative as well. So now even BFHI promotes in its step 4 that place the babies in skin-to-skin contact with their mothers immediately following birth for at least 1 hour. Encourage mother to recognize when their babies are ready to breastfeed. And most of us believe that when are the babies ready to breastfeed? When they cry. Am I right? No, no, it's not cry. So crying is a late sign of hunger, and the baby should be fed on hunger cues. These are simple movements of baby's mouthing or making some sweet sounds, cute sounds, and early awakening. That's where a baby must be offered breastfeeding. This is the time when it has got some more patience of around 10 to 15 minutes so that a mother, especially primary mother, when she is learning how to attach the baby, she has got some time. Once the baby start crying like anything, it's very difficult to manage the baby as well as mother as well as grandmother. So baby should be given hunger cue based demand feeding. Every time when a baby demands, most of us, most not all at least, most of us would say that the baby whenever demands, the mother should sit down and feed with the fear of aspiration either into the lungs or going into the ears or into the nose. If the mother, whatever amount of exertion she has, whatever amount of tired she is, she has to sit down to feed. That's what I used to advise during my residency days, and I see most of the people doing so also. And that's why I wanted to keep it over here that while feeding, sitting is not compulsory, and that's what is called biological nurturing. They said that if there was nobody to guide any mother, if her mother is primary, and if she does it on her own instinct, most probably she would lie down at a condition of her comfort. Something like if you want to see a TV serial for 1 hour when the grandmother is not available and the mother, the sister, the wife has to see the TV for one, if they want to see the TV serial for 1 hour, what position she will try? That's what is called biological nurturing, reclining somewhat, and where the baby is actually lying on the mother. So baby is feeding in the prone position. That is what is happening in nature. You can see over here. And if there are two babies, then also it is possible. In this condition, actually, mother will get relaxation, will not get exhausted while feeding. So every time a feeding session of 15 to 20 minutes and around 10 to 15 of such. So total of 3 hours of extra rest would be available for each mother while breastfeeding every time. So every feeding should be allowed, every feeding should be promoted to be taken in laid back nursing. While nursing, there are four signs of each good: mother's position, baby position, latch attachment. This is what I learned during my MD preparation of 1998, in which I was a ranker, but even then it was very difficult for me to remember all these four signs. So I humbly suggest, this is also I got from somewhere, that there are three signs, B, T, and C. If you remember these things, you can easily guide a mother to breastfeed. Simple. First is baby to breast. So baby is brought to the breast. Mother should not lean forwards, neither pull the breast towards the baby. It will make the shape rounded and difficult for attach. Second is tummy to tummy. So baby's tummy should be touching mother's tummy. And third is nose to nipple. So I'll show it again. So when the baby is trying to suckle, look, mother is not giving it directly into the mouth. It will allow him to touch on the upper lip and nail. And once the baby opens its mouth, it will start suckling where the chin is touching, cheek is touching, and even nose is touching. Frequently, the grandmother will scare the mother to take care of nose not being blocked, but it is not so. The mother should be allowed to suckle. One slide I just wanted to show that there are certain things we should say no. Earlier things were promotion, and this is something not to be
Vidya,
promoted. So one of them is colostrum harvesting. There are certain things which are brought with fascination. So this thing is not actually important for each and every child. It is for very limited number of babies. They have tried, and this is not required for each and every child. So I would not advocate that we should promote this colostrum harvesting. Same is true for breast pump, nipple shield, nip care lotion, nursing pillow, feeding nipple. Unfortunately, currently breastfeeding promotion or promotion currently is now use of these instruments more rather than going to the basic method. It is something like using wheelchair instead of your own legs. Before I move on to, would like any of us to ask any questions? I can. Or I'll just go for some rapid fire rounds and then we can go for question answer. If these were sent to me by Dr. Shwetal Ben. So, what is the biggest mistake pediatricians make? I would say I do support exclusive breastfeeding, but saying but, if you have any but, then you are not supporting breastfeeding. So first you have to remove that but and you will find out of ways. Then second thing is alone, how many things I can do? No, you can do at least, see, what I believe is if you can help your own child of your own family child, that's also sufficient. Don't worry about the entire community. What's the biggest mistake that nurses do? They do not own the job. They believe that this is their job. It is not their own brother's child. If they are carrying their own brother's child, how do they behave? That if they do it, they'll do several things correctly. What's the biggest misunderstanding of mothers? Most of the mothers, they are having that feeling that I'm not that capable. It's a guilt, I think. That's the biggest mistake of mothers. Mothers are made by nature. So I mean, are humans that much smarter that they can they can find out mistakes in the nature's provision? No, not at all. Then one counseling sentence that changes everything. Well, it's a praise. So best part is you are so much motivated. If I say to the mother, their mood changes. Then when I say that most mothers with such troubles learn to tackle them, that also helps them. Then one intervention that increases exclusive breastfeeding rate the most, I think that's the breast crawl at birth and not just at birth. It is later on every time till even 5 years, no problem at all. Then one thing that every NICU should implement from tomorrow, I'd say why from tomorrow? Today only. Involve the mom as much as possible. See, moms are the best caretakers, naturally, instinctively. Nurses are there, but they are professionally. The mother is there as a emotionally. So if we can involve them, that would be a great thing. If you could change one hospital policy, what it would be? I would say learn and teach how to breastfeeding in restful reclining position and pleasurable closed latch. If you learn it and if you teach even one mother, I'm sure you will continue for your entire lifetime. Then one breastfeeding myth you wish to it should disappear. Well, there are hundreds, so there is no single answer. I'll say some of them. મમ્મી થવા માટે થોડું તો સહન કરવું જ પડે, which means if you want to be a good mother, you have to learn to bear. This is a misconcept. Motherness or motherlyhood is a pure joy and happiness. If there is anything less, the mother should ask for that. Then suta suta aspiration is something. Then nose block na થાય. Because of that nose block fear, the mother will not bring the child closer and the latch will never be complete. And then that famous પહેલા 2 દિવસ તો ફીડિંગ ઓછું જ આવે, especially cesarean પછી તો ના જ આવે. This is everyone's belief, including me. When it was my own child for first 2 days, I had also given breast milk because at that time it was around 23 years back. But my own brother's last child had not received a single drop of anything else than breast milk right from day one, and that child was 3.8 kg at birth. I'd like to thank organizers for inviting me over here. I'd like to thank audience whomsoever be present. I'd like to thank patients who have taught me lot many things. I would like to thank my family, including my team at my hospital, and over and above all the persons who are present over here, including the NNF Gujarat team. I would just want to see a simple video. This is today morning's video while I was demonstrating. I was just demonstrating how a mother can feed a baby in reclining position. And this is a video which shows that it doesn't make any difference to the baby whether mother is sitting, sleeping, waiting, anything. This is today morning's video only. I think I'll stop over here. I've not taken much time, I suppose, and
Thank you, sir. Shwetal madam is there?
Yes, ma'am. It was really an excellent presentation, Parag bhai. મેં કીધું ને આમ ફટ દઈને ગળામાં ઉતરી જાય, that is your language. Very sweet and very comfortably the understanding is there. And in fact, I was thinking I would like to invite you for my residence also whenever there is a chance for
whenever you say,
making
ma'am, I'm
them.
always there. I would be
Yes.
really happy to
Yes,
meet
and you
people
took the
and share.
rapid fire so well. Like it was such a simple thing that they don't know that job, or the misunderstanding of mother is really we
They are
make
gay.
mother that you are not capable. Our
They-
language is that harming the mother.
Yeah.
So we should be very careful, and very nice data and this updated version of your expert talk. It's really very, very nice presentation. And like the thing which you have said that the KMC and breastfeeding, which goes hand to hand, the pain and KMC, these are very simple things to be implemented in NICU. But still, we are lacking. Like daily in the morning round, I have to say, bhale NBM rayu, but colostrum painting to karo. So these are the things. And so while hearing to you, I was just, and mother is the best nurse. So while hearing to you, there came in a research idea in my mind that why can't we start mothers, like whatever the nursing staff can at least spare 15 minutes daily to with the 4-5 mothers to tell what, like how to change the nappy, what is the pain care, what are the importance of breastfeeding. Because if they talk with 2 to 3 or 4 to 5 mothers together, the support system is built. There is a group behavior will be there. So really very nice presentation, Parag bhai. Very, very practical things with data support. I am very thankful to you for such presentation. And indeed, you are a stalwart of breastfeeding promotion in Gujarat. Thank you so much.
I believe we trust more on ventilators and surfactants and
Yes.
than
Even
breastfeeding,
the
but,
new generation
I have
resident coming
seen
to
it that this
NICU.
works so nicely. The rates of infection in my NICU is reduced mainly because of these things. We hardly use now several. Earlier we used to use chloramphenicol as well. Now last 5 years I have not used it.
Great. You should publish it, sir. So that will be motivating for others also. Great. And the HMO was really wonderful. Yes, people are behind that. The formula company stands in front of us and we said, no, we are not going to. You know what I have started implementing? We have orphans also in our NICU. And like we have the mothers who are very sick, or mothers because of critical illness are passed away. We have a formula register. We write it down why we started. What was the reason? If we start auditing our own self, the
Yeah.
usage automatic comes down. We
Yeah,
don't
that is-
ask from a hospital supply formula. We ask to one of the NGO where there is a special circumstances, then only he will come. So there is a lot of efforts to put, we have to put in to get the formula, which makes, in fact, the formula usage is almost, I say, just because of the orphan which we get, otherwise it is zero at our NICU, and I'm really proud of it. But I have to work too hard. My vacation, my summer vacation, I have to revive the system. So this is going on. Yes. So thank you. It was really wonderful.
I was
What
trying to
Dr.
tell
Purvi?
the
Mehul has raised the hand. Yeah, Dr. Mehul has raised the hand. Dr. Mehul and Dr. K. Kasuvali, sir. Sir,
Yes, sir.
and
Sir.
Yes. Sir,
yes,
your
sir,
comments.
you are and Dr. Mehul, yeah.
Sir, Parag sir,
Yes, sir.
my pranams to you. What a great talk. What a great talk. I really enjoyed. I'm very proud to be a participant, and really, sir, what a great talk, sir. No words. I can simply say your talk is SSC, short, sweet, and cute. Really, I agree with each and every word. The way you spoke, oh my God, you are something like a Lawrence of India, Lawrence of India.
Sir.
Sir, see, I want because the certain things should come from the mouths of people like you. You know, see, I've been doing a lot of breastfeeding counseling trainings all over the country. So off late, say I am seeing from the counselors whom I have trained, so they pose their issues in the group. And sir, I started pumping and taking milk and feeding the baby. Hurry, we say that we never told you about pumping. Why are you doing using breast pump? Sir, it has become a big menace. It's not their fault because of the aggressive marketing by the pump manufacturers. They made that every feeding mother should have a pump.
Yeah.
And recently, the data is coming that because of unnecessary pumping and aggressive pumping, there is a possibility for the breast to develop chronic granulomatous mastitis, which is a precancerous condition. I do not know why the people are behind pumping, and they forget the manual expression and direct breastfeeding, sir. I do
Yeah.
not know how these things are going to be managed. I need your few comments on this.
Sir, most of the babies from my NSU who go home who are in the weight range of 1.6 to 2 kg, they go on breastfeeding
Yeah.
directly.
Yes, sir.
Remaining those who need extra supplementation, they go with cup feeding. I
Yes,
actually
sir.
didn't show a video of cup feeding, or I will shown that also, that we don't use bottle at all. We just use cup feeding. It's a small size cup. You can use anything. I mean, you have
Yes.
those glass cups for shots, I think. So that can be used for this purpose as well. And they are currently, as you rightly said, sir, if at all there is any problem with breastfeeding, the mother will have a nipple shield, will have a breast pump,
Oh,
will have everything. But nobody will to examine the mother while
yes.
breastfeeding. A simple thing, if at all there is any trouble with breastfeeding, first thing is being a doctor, you have to see what is going right live, what is going on while the baby is suckling at breast. It is something like if somebody goes to a physician and asks that, okay, I have a chest pain, the other person says, okay, you do a bypass. Simple. Well, if there is a chest pain, you examine the patient. Similarly, if there is any trouble related breastfeeding, you have to examine while the baby is suckling at breast. And 99% you will find out certain simple things which you correct,
Yes.
and the things are over.
Yes. Yes. Thank you,
Yes,
sir.
Mehul
Thank you.
bhai, you
Yeah,
wanted to say
one more
something.
question from Dr. Mehul.
Mehul bhai.
Very good afternoon, respected all, and Parag sir. Nice presentation. We'll quickly ask two queries. Sir,
Yes, sir.
one you said about very good concept of breastfeeding in 2 to 5 years. So
Yes, sir.
your opinion and available evidences on that. And second, sir, બીજો પ્રશ્ન છે કે tomorrow I am having meeting with my PGs, new batch, to allot the thesis. So one topic I come to know from one of the pediatrician who has recently visited from USA to Bhavanagar. She told regarding the successive feeding. What she told is that at evening from 7 to 10 p.m., consecutively 1 hourly interval, she will feed the baby. So thereafter, after 11 p.m. or 12 p.m., there will be gap between 12 to 6. And that will also help for the mother for resting, successive feeding.
Cluster feeding.
Sir, this is
Cluster.
cluster feeding. This is nothing new. Let me answer the second question first. The baby, I have seen it in my own family members as well, and that's why I'm saying. I mean, the mothers who, those ladies who already become mother, they must be knowing. The baby at some times takes feeds, passes urine. Again takes feed, passes stool. Again takes feeds, passes urine. Again takes feeds, and then goes to sleep. And then another 2 to 3 hours it is again, and then the cycle repeats. This is called cluster feeding. It is absolutely normal, natural. We cannot induce it. It is automatic. If it is happening, let it happen. There is nothing like 2 hourly feeds or 3 hourly feeds in nature. So whenever baby wants, it should be given. That is simple thing. Okay, so cluster feeding is absolutely normal thing. And then the
But
first.
we cannot do a research on cluster feeding.
No,
Like
no,
we cannot
it is
induce
natural thing.
cluster feeding.
You can induce
Because
it. No
otherwise
problem.
you will disturb the
Disturb the
prolactin
cycle.
secretion.
Yeah,
Because the
whatever is
night feeds are
happening,
essential for the prolactin.
yeah, you go with the flow. That is simple thing.
Ah,
Yes.
yes,
Simple.
go with the
Okay.
flow.
And first question, sorry, Mahel bhai, that was?
2 to 5 years
2 to
breastfeeding
5
to be
years.
continued. Evidence on that.
So why do we want evidence?
Because now it is era
Did
of
we have
evidence-based
evidence
science.
of giving cow's milk or goat milk to a 3-year-old child? Did we have ever? And I am asking, I'm saying about human baby, human milk to a human baby. What's the harm? How can it be harm? And that is what our education currently believes. We need evidences for Mahatma Kangal Peravat and evidence kya save Apollo. Sir, we are talking about human species. Human milk is much, much superior than anything. Am I right?
Yes,
I give
true.
example of people who are given, and sir, આપણી પહેલાની generation, આપણાથી બે generation પહેલા લોકો, they used to give breast milk for 5 years. Today also in Rajasthan, most mothers give feeding up to 5 years, and that was
Yeah,
right. If the mother and baby were
true.
separated for 6 weeks, nobody was allowed to go by their side. That was right. So not that every advances is actually helpful. So we have to go back to what was actually designed, and that was really normal thing. We should allow them to do. We should rather help the mothers to do. We don't need evidences.
I
Sir,
have
If
Parag
at
sir.
all, if at all you want, I'll try to provide, but we don't need evidences.
Sir, Parag sir. So
Yes,
I am the
sir.
living example who has taken motherhood up to 6 years.
Yes, I'm saying I have given an example. I mean, there is a group called, you were not there. There is a group on Facebook which is called Breastfeeding Support for Indian Mothers. The admin of that group, Adhunika Prakash, has given breastfeeding for 13 and a half years to two of its child. One child 7 years, one child 6.5 years. My own cousin nephew's child has taken breastfeeding till 7 years. She completed before 1 year. So there is no rule as such. Even science has said 2 to 5 years or more as long as the baby wants. There are examples of babies taking feed up to 10, 13 years. I'm not talking about those exceptions. I am talking about routine babies. They should receive breastfeeding till 5 years because till then that's a requirement. We anyway want ourselves also to take milk for entire life. રોજ સવાર ઉઠી એક ગ્લાસ દૂધ પીવો છો કે નહીં સર? કયું દૂધ પીવો છો? ગાયનું, ભેંસનું, બકરીનું? Why can't you take your own mother's milk?
Okay.
So,
Sir, I have a question.
yes, sir.
You had said there is no need of antenatally or in pregnancy time to go for colostrum harvesting. It should not be done.
Yeah, it
So
was
then
that.
how earliest after delivery you think we should start, or
Right
immediately?
on day one. Right on day
Immediately
one.
it should be
Right
done.
after birth. Yeah, the breasts are ready after 5th month of pregnancy for breastfeeding. So if at all the baby delivers at 7 months, on that day also, that baby will get breast milk if proper method is applied, if the
Yes.
mother is relaxed enough. And this was given example by Dr. Sushma Nangya in my training days. He said she had done it for her own resident. Her resident had delivered a baby and she said, okay, my mom, ma'am, I don't have breast milk on day one. She helped her express breast milk right on day one, and 20 ml was given to their baby. "Le beta, tu aap." Simple. So we have to believe that it is possible.
Yes. Any special case in which we have to do it in the antenatal period, colostrum
Well,
harvesting?
it was introduced for patients with diabetes mellitus in the hope of preventing hypoglycemia by providing
Wonderful.
this milk. But then it can be done after birth as well. It is not compulsory to express beforehand. I think it might be helpful in some preterm babies where stress and other things may cause trouble in initial days, and this milk may be helpful, but then it is not something for each and every mother. It is for very selective mothers.
Okay. One last
But
question.
then, Urvi, the colostrum harvesting was not recommended during, like, if there is a early delivery on table, you can do. Otherwise, you will induce the
Yeah,
delivery.
there is a chance of
So,
stimulation of
yes,
oxytocin as well.
No,
yes.
there's a myth.
So,
So, sir cleared that myth
yes,
in the
yes,
presentation.
yes,
So, I'm
Yeah,
yes.
yeah.
just asking for
It
in
is like
reference to that
if
question.
yes,
Yeah,
it
I
is like when you
specifically
there is an
included in
on-table possibility, the separation or anything, that time you can do a colostrum harvesting.
true.
Otherwise,
Early in the
not in the
antenatal
early.
period.
That's
Nahi.
Just
why
to
I included
clarify
in
that myth,
more.
I am discussing it.
Yeah,
Okay.
that's why I
Yes, yes,
included in
yes.
more. Yes.
One very practical question, I think, which we all face in our practice is that every mother or relative, especially the mother-in-laws, asking that the baby is remaining hungry, please give some formula. Like, how do you do the counseling? That is what I want to know.
You know, Ruben, how do we decide that baby is remaining hungry?
Okay.
We decide that, okay, baby is crying, he wants more feed. But if baby is given more feeds, at that point, if the baby starts suckling, there is no problem. I showed my own video at the end, very end, and that was the
Yes.
same purpose. That crying is not for milk.
Milk.
Crying is for the warmth, crying is for that suckling. And a breast, if it provides these two things, even if no milk, that is sufficient. And breast is designed to provide milk. So whenever there is suckling, milk is going to come. So only thing is that we have accepted that probably there is some disease in the mother, in 50 to 80% mothers, where they cannot produce sufficient milk. The disease that nature actually forgot to create, we have created, and we have now find out the symptoms, and we are trying to treat it as well, which does not exist at all.
Correct.
Simple. If a cat has 4 babies, 4 kitten, will it produce milk for 4, 2, 3, or 1?
4.
4. If she has 2 kittens, she will produce for 2. This is simple demand production. So, do you remember any one medical condition when mother will have less milk production? See, it is 200 required and mother will produce only 150. Tell me one condition. None exist. I know. Exception, you forget about those 1 in lakh entities. Okay. For common things, there is nothing like it. So practically, there is no disease where a mother can produce less milk. If
So
at
I
all,
just
there
want
is,
to highlight this to the audience also,
I
that
know.
we have a common problem in our practice, but don't get swayed by it. Just counsel, and whole family counseling will help. That mother will be helped
And,
for breastfeeding.
and do an examination. What does
Yes.
mother do? Even when she's saying everything is right, then when you see,
No,
you
we
find
need to
out
examine. We need to
you
examine.
find out that there are some things which mother has taken as to be normal.
Yes.
But when you see, you find out, okay, this thing can be rectified, and the things will be easy.
Just 2 days back, I had got, and mother-in-law wanted the mother to work in the house. So she was telling, your baby is, I'll feed the baby, you just do the housework. So these are common issues which we face practically. So we need to sort them out. So just like that. Yeah, Dr. Ronak, you want to ask something?
Parag sir.
Yes, Ronak bhai.
You are Sir Vaibhav Suryavanshi among the all
Prabhu. Prabhu.
Sir, I just want to say that the globe is celebrating the World Breastfeeding Week since 1992.
Yes.
It's almost around 35 years.
35 years.
With the purpose, what we started celebrating the breastfeeding week to improve the rate of the exclusive breastfeeding. And we are doing the extensive work to improve that rate, but somehow I feel that whatever we are doing has not achieved.
True.
So we have to work even more, or we have to change our ordinary methods, what we are doing since last 35 years.
Yes.
Your comments on that, sir?
Sir, I believe that mother is the most neglected part in entire thing. If we keep mother in the center, if we keep her comfort in the center, things will be easier. I cannot ask a mother to give breastfeeding for 5 years if it is not enjoyable to her. I cannot ask a mother to exclusively breastfeed if it is painful to her. That pain is so much. I mean, that all the mothers must have, have gone through it and must be knowing that it is excruciating pain. Backache of mother, which we commonly attribute to CS and other things, that needs simple solutions. You just lie down in relaxed position. That position will solve. So if we keep the mother in the center of breastfeeding, if we take care of her, the baby's care will be automatic. I don't worry about it. That's just one thing which we are missing. We always have focus that mother has to sit down. Even in KMC, we generally advocate that the mother has to sit down and in reclining position only breastfeeding should be given. And it has been already proven that position does not make any difference to any baby.
That's right.
Neither for GER, neither for aspiration, anything. Even then, we have stick to those stigmas, those misconceptions. Even we pediatricians, I'm not blaming anybody else. We are the first persons. So we have kept it in our mind, and that's why the things are not improving. The day we we will empower the mother to behave on her own instincts. We will not stop interfering. I think things will be much easier.
And one more thing is that for narcotic drugs, for antipsychotic drugs, we have triple prescription. But the formula is available OTC. There is no check on that. Anyone can prescribe. Clinics are running on that. So there we need to do it. There we need to make a break. Anytime if you see any hospital's pharmacy, the
And
formula,
despite of
even if
existing
it is
IMS Act.
yes, in spite of, because IMS Act just 5,000 rupees and 6 months of imprisonment. 5,000 rupees कौन नहीं भरी सके?
And
Right?
India, madam,
And
possible
it
nothing.
is like neat paper leak. If you make the law strict 10 crores in 10 years, then only the things will be improving. Otherwise, it's not going to, because it is very easy. The thing is that they feel it is very easy, and the picture shown that your baby will be very chubby, the concept of that, which is misleading. And we pediatrician needs to work on it.
Okay, I guess,
Sir,
yes, yes.
just one more question from my side.
Yeah,
Sir,
Vishal.
it was an excellent presentation. I just joined late actually because of medical emergency.
Vishal
I
is
don't know
also one
anything.
of the partner to me for inviting Parag Bhai. Thank you, Vishal. We were
Yeah,
discussing.
thank you.
We both were discussing. कौन है बोला ये? कौन है बोला ये? Vishal के मैडम Parag Bhai ने. I go, okay, चलो. You suggested a very good.
Thank you. Thank you.
Okay, sir, just one question. I
Yes, sir.
presume that Parag sir જો જે પણ patient આવતું હશે એને breast milk આવી જ જતું હશે automatically. But the thing is, in NICU practical thing, those who are preterm baby and those baby could not get the mother's EBM, what advice you are giving or any medication did you advise routinely? I don't know how much you are routinely doing because
Then
as
I
per
have
Malware, you are excellent in counseling. Based on your counseling, maybe the milk is always would be fulfilled. But what about the other center? So what I supposed to advise to the mother
okay,
apart from
Vishal.
counseling?
This is really a good question, I must say, and this is probably applicable to all NICU settings. I agree. So, first of all, I would suggest that if possible, we create a team of at least 7 nurses in our department, so that round the clock there are at least 2 nurses available who have adequate knowledge about this subject, who can help mother really well. With that, 90% of my job is done. Let me say you clearly. Now, our nurses, they do most of the work. And when they get halted, they get obstruction, then I'm there to help them out. Last time, I mean, over last 20 years, I have prescribed metoclopramide or leptadine for not more than 2 times. Not more than 2 times. And
Great.
believe me, I mean, I'm not saying that it is not prescribed in my own department. There are others who still do it, but at least from my side, I have never been needed. And then all the mothers, if I show them the correct method of expression, if I show that correct method of attachment, and if I try to make them relax, if they do, things gradually happen. Every mother has given breast milk. It has never been a trouble. So I'm saying that yes, we do use formula. We do use breast milk of other mothers relative as well. We ask for them. Okay, if you are not available, then you bring mother. And we ask early on day one only. We after our counseling for newborn is over. The next thing is okay. You start mother to express breast milk and send it over here. If it is cesarean delivery, the mother is a distant place. Then we ask them at least start getting process started. Then most of the times we get quite early. If it is not available, we have only limited choices. In private, there are no breast milk banks, so we try to do unofficial milk sharing. We try to do milk from other relatives in the family, and then, if possible, breast milk, but which is currently, I think, in Arpan only, and one more place in Ahmedabad, nowhere else is available. I think in UN Mehta. So nowhere else is there. So
Yeah.
it's for private setups only. So we don't have other options but formula. But then the use of formula is actually very, very less.
Yeah, so this question is because our 99% babies are getting EBM or either donor's milk, but this question of 1% who are not allowed to give the consent because it's a formal consent is we need actually. So that's why I asked this question.
It is okay
And
for
that,
1%, but currently even 80 or 50 to 80% of normal babies are getting formula. That is where my problem is. I'm not worried
yeah,
about that 1% in the NICU. They naturally need it. That's okay. But the one who are out, who are normal, who are healthy babies, they are also not getting breast milk because of so many misconceptions.
So I think after a very excellent interactive discussion and enlightening discussion from Parag sir and all the participants, Parikh sir, Dr. Yogesh Parikh sir, is there?
Yeah, I'm here also. Dr. Biraj is also
You would
here.
like to?
Yeah.
Biraj is also there. Yeah, Biraj, please take over.
Yes, sir. Perhaps, sir, there was an excellent presentation. Though I missed in between, definitely I'm going to watch it on the YouTube later. But I myself has a couple of questions, and I had sent a couple of questions to Shwetal ma'am too. So, sir, what about pasteurized human milk? I don't know whether it has been covered throughout the talk or not.
No,
Would
no,
we
I didn't.
not
I
covered.
didn't
No, no,
cover.
no, not covered.
So is
Pasteurization
it
is
like the commercially available pasteurized human milk? So that is what the one thing which I think, along with the breastfeeding, we should be discussing out. Any suggestion about the same? Because that's also been,
well in comparison to breast milk, the immune factors will be lost. So pasteurization will do at least one thing, and that is the loss of immune mediated
Immune
whatever
systems.
helps are there that will go away. But it will otherwise it will be a little more cleaner, like non-infected material for the baby, and it will be better than the formula at least. So it can be preferred over formula, but wherever available, mother's own milk
Yeah,
in
the
the
best
fresh
is
form
the mother's
is the
milk,
best.
definitely.
Is the best.
And what about CMV for the preterm? The chances of getting CMV for the premature babies with the breast milk? Or is there any special preparation like freezing out the breast milk? Because we had one patient who has a CMV through the breast milk, and we found the CMV PCR positive, and the viral load was quite high in the breast milk, and the child was having also CMV. So that's like there were a couple of studies which says that you need to have a special preparations for the breast milk. But if I'm doing that, then I need to express the milk, then pasteurize, or else frozen the milk, and then only it is to be given to the baby. So do you advise anything? Because there are no clear-cut guideline about the same.
Honestly speaking, I'm not aware about this specific condition, what you described right now. CMV infections, I mean, CMV, every encounter to a newborn baby is not equivalent to infection, number one. So, if the baby
Yes.
is getting CMV, that may not cause any trouble to the preterm, that's also very well possible. So, if it is, so I would rather like to read little more and then only would like to answer. But every CMV, I mean, otherwise it asymptomatic CMV can be there with
Yes.
many mothers, and many preterm babies mother will have CMV positivity. Up till now, I've not read about that. That thing specifically needs to be tackled in separate way. You need to screen the mother for CMV, or you might, if it is positive, you need to take care that milk becomes CMV negative, and then only you have to give. I'm not aware about it.
Yeah.
I think,
Yeah, but
sir,
if the baby is asymptomatic, and if you want, you can test the baby for the like urine
CMV
PCR. You
count.
can get it checked. If it's not positive, then I think it's not getting affected.
I would like to add one
There's
point
only
for the CMV.
symptomatic
Actually,
CMV is the one thing, which, and when you just look at the what are the modes of transmission, the patient does not even. Yes, sir. Would you like to answer this? Kesavalu, sir.
Yeah, yeah.
Yes, sir.
Madam, sir, is only adding to Dr. Parag like this. Sir. So one thing we have to keep in mind. So even in HIV infected mothers, even a mother is not on ART, there is no 100% transmission. It's a HIV infected mother, when she breastfeeds, every day 5 lakh virons are transmitted through milk, and 25,000 infected WPC babies getting from the mother without ART. Right? There is no 100% transmission. Another thing is we have to keep in mind
non-medically.
our immune system is not weak. It produces antibodies against whatever infection mother gets. So in the same way, in the CMV infected mother also, mother will be producing antibodies or anti-infective substances against that CMV. Just because the baby is found positive, we cannot say that baby will get disease. So this thing we have to keep in mind, madam.
Definitely,
I
sir.
think,
So it is kind of, sir, the way for the blood transfusion, especially in the case of the preterm babies, in the neonatal case, we just go for the leukoreduced transfusion. Similarly, because the major chunk of getting a CMV or a symptomatic CMV for the baby is one of the thing is blood, and second is the breast milk. And for preterm babies, so I had read a couple of articles. For preterm babies, there are a couple of preparations. Either you just express, pasteurize, and then give breast milk. Definitely, there is no alternative to breast milk. But is there any special preparation which is to be done for the breast milk to
Madam, you
avoid
try
such
to
risk?
understand.
As
Madam,
he
try
said,
to understand. There is a hand of industry in this type of issues. They want to make an opportunity to promote their formula. To
with
promote their
CMV virus,
formula, they enter in this way.
With CMV virus, there are antibodies as well in the breast milk, and that is protecting not only just breast, the CMV, that will protect against hundreds of different things as well. So in HIV, they found out that if
These are all
the mother
industries
is
play, madam.
allowed to
Industries
give
play.
breast milk,
But that's what I'm telling you. Breast milk is 110%. It is to be given. Any special preparation is to be done on the
I am
breast
not
milk
aware.
before
I am
giving.
not
That's
aware.
what
No need, madam.
I am
later
not.
there
No
is
need for the
no clear cut.
preparation.
No need.
Okay, so I think I just want to add one point for the Miraj. First of all, liquid is not going to be reduce the CMV load. So CMV negative blood we need, and out of 10, 8% are CMV positive in India. So we can't rule out that. If preterm baby does not have any history of the blood transfusion, then you think about CMV related to breast milk, and we can't do anything for that. Because this preterm baby are less than 28, because they might have an immune issue because of the preterm, not lifelong. So in that case, you can do the CMV PCR, and if your baby is symptom, you can give the antibiotics to
Yes,
that baby.
Vishal.
Otherwise, we
Vishal,
can't
I'm
do
not
that one.
asking about the
No, here
CMV
our question
I,
is different.
I,
Our question is different. Just understand the question. She's
so
just asking any preparation needed or not needed.
I am
That's
No,
it.
not
there is
Because
no
we
any
knowledgeable
know
about
that
preparation
that is a
available
main
in
point.
world
Don't
over.
forget it.
No need.
No,
Anyways, chalo.
no.
So
Because by
till now
doing
there is
that,
no clear-cut conclusion, and
Dheeraj
we are
Ben,
giving the same milk without any extra preparation, either
yeah,
frozen or pasteurizing, right?
by doing that,
That
there
is
is a
what the
chance of
box is.
increasing other infections. Our ultimate outcome, that will not be possible. That's why.
Okay. Fine. So with this, it was a nice discussion, nice presentation, and as Kisolu said, short, sweet, and like 3S. So definitely, Parag sir, wonderful discussion and wonderful presentation. Thank you very much for agreeing for this talk, and Dr. Shwetal ma'am, thank you for being a project in charge. Urvi, thanks for coordinating and taking my role and my absence. Yogesh sir, thank you very much. Thanks all the chief guest and the guest of honor, Dr. Umang sir, thank you very much. And thanks all the audience for joining, and wish you all a happy breastfeeding week.
Yeah.
And yeah,
So
one more thing I would like to announce is that we have an oration on breastfeeding, and it is really wonderful by Dr. K.K. Devakar sir for our Gujarat. That is on 16th of August, next to next weekends. And we have an IKMC workshop for the same. So do register for the workshop, and do join us for conference Gujarat and West Zone Paricon. And with this, I would like to end. Yes, sir?
Yeah, Viraj, 1 minute, Viraj.
Yes, sir.
1 minute. So all are the now the Gujarat people are here, na? Keshwalu sir.
Yes,
Thank
sir.
you very much. Thank you very much for the your gracious presence and